OP7, oral presentation 7, is autonomic functions among fuel handlers in the Gampa district. The authors are Dr. Madagoda K, Dr. Kotahachi D, Dr. Luke D, Dr. Vadasinghe D, Dr. Aryavansa D, Dr. Aryavansa J, Dr. Ratnayaka P, Dr. Disanayaka T, Dr. Disilva D, and Dr. Devanarayanan N. The presenting speaker today is Dr. Varna Kulasurya T.
Good afternoon, everyone. Today we are going to present the study on autonomic functions among fuel handlers in the district. And this is a part of the study where we evaluate the health effects of exposure to fuel among fuel handlers in the district. Sri Lanka has seen exponential economic growth and with it an increasing number of motor vehicles. And air pollution due to these increased vehicle emissions have been related to adverse health effects. And the Department of Motor Traffic in 2015 reported about a 3 times higher new registration of vehicles, of which 96% of them use either petrol or diesel as a fuel. With this, number of fuel stations and number of employees within them have increased due to the demand. And there's a long working hours to these fuel handlers. And in the same study that we did, our Netherlands collaborators examined the VOC levels within the exhaled air, and it was seen that fuel handlers are exposed to more volatile organic compounds such as benzene, toluene, and cyanide. The central and peripheral nervous system is affected by these pollutants, and altered heart rate variability have also been seen on exposure to these air pollutants. So our objective was to determine the changes to cardiovascular autonomic functions and heart rate variability measurements among fuel handlers in Sri Lanka. And the ethical approval for the study was granted by the Ethics Review Committee of the Faculty of Medicine Municipal Government. And we selected 7 fuel stations in the Gampa district where 50 million fuel handlers were chosen consecutively for the study. 46 age and gender matched individuals were recruited from the Ragam and OH area as controls. After giving them the information about the study, informed written consent was obtained. Then an extensive questionnaire was filled out, and the physical examination was conducted by a consultant physician. Then the autonomic function assessment and heart rate variability measurements were performed using analytical protocols at the Faculty of Medicine Municipal Government Department of Physiology, where we have an autonomic unit. The subjects were pre-prepared for the test, and the advisory refrained from any beverages containing caffeine, nicotine, and alcohol, and any medication that could alter autonomic functions were absent as well. And we tried to complete the autonomic function assessment between 9 a.m. to 11 a.m. in all the subjects. They came in fasting and had a preset meal, a standardized meal, after which they were rested for 20 minutes before the baseline parameters were recorded. 5 minutes of continuous ECG was recorded using the PALA, and it was analyzed to have software of Charlie or heart rate variability analysis. The autonomic functions we conducted were brass index, the heart rate variation during breathing, and then immediate heart rate response to standing and head up tilt, and heart rate response to Alzheimer's maneuver. The sympathetic functions evaluated by blood pressure responses to standing and head up tilt, then isometric hand grip exercise to coordinate the response, as well as blood pressure responses to mental variabilities. Heart rate variability measures the variation in the RR interval between consecutive heartbeats. And this uses both time domain measurements and frequency domain measurements to measure the parasympathetic as well as sympathetic functions of the heart. Because the autonomic parameters were not normally distributed, we use non-parametric methods for data analysis. Moving on to the all important results. There were no significant differences in the weight, height, or the body mass index, and of course, they matched for the age. So these are the parameters that could alter autonomic functions between the two groups. So they were comparable between the fuel handlers and the controls. The baseline parameters, the heart rate is lower among fuel handlers, but the supine systolic blood pressure and supine diastolic blood pressure was significantly higher among the fuel handlers compared to the controls.
The resting heart rate, although low, was not significantly low. Among the cardiovagal parameters, the valve-salver ratio was significantly higher among the full handlers, and this is a parasympathetic parameter. So the valve-salver maneuver is performed, the RR interval is measured right after the strain, and then RR interval is measured within the strain, and the ratio is calculated, and it was significantly higher among the full handlers. Other cardiovagal parameters were comparable between the two groups. Of the sympathetic parameters, a rise in diastolic blood pressure on sustained isometric hand grip was significantly higher among the controls. So it was significantly lower among the full handlers. So this was a sympathetic parameter which was lower. The other sympathetic parameters were comparable or similar between the two groups. Moving on to the heart rate variability, the standard deviation of RR interval, or CNN, is a global parameter of the autonomic functions. And this heart rate variability parameter was significantly higher among full handlers. All the parasympathetic heart rate variability parameters were also higher in the full handlers, although only a CNN was significantly high in the full handlers. When we measured the exposure hours within a week and the parameters, the baseline diastolic blood pressure significantly reduced with higher exposure hours per week, and delta heart rate during inspiration and expiration, which is also a parasympathetic parameter, increased with increased exposure hours among the full handlers, and this was only analyzed among full handlers. So similar to our study, higher resting systolic and diastolic blood pressures have been seen in humans as well as in laboratory conditions before. And this is supposed to be attributed to oxidant stress and catecholamine release causing a vascular response. A lower heart rate, higher valve-salver ratio, and lower diastolic blood pressure rise to sustained hand grip together suggests a cardiac parasympathetic predominance among full handlers, and a higher HRV is considered to be beneficial and cardioprotective, and also shows a parasympathetic predominance, and the higher HRV parameter supports the finding of, in the autonomic function analysis. So in conclusion, altered autonomic balance was observed among full handlers with a parasympathetic predominance to the heart, suggesting autonomic function alteration on exposure to volatile organic compounds. Long-term health assessment, monitoring of air quality at the workplace, and restriction of hours of exposure per week, and use of protective equipment are always recommended for the full handlers. We would like to acknowledge all the participants in the study and owners of the fuel stations who cooperated, all the staff members from 2018 to 2020 who assisted, and the University of Canada Research Grants for funding the study, and the Ceylon College of Physicians for the opportunity to present the findings. These are the references that we used. Thank you.
Okay, now it's time for questions and answers. Silas will ask the question.
Just talk to the
Why? Yeah.
sir. No, just talk loud. It will be okay.
Yeah, why decide to do this on fuel handlers? Is there any evidence that these cause autonomic neuropathy?
Initially, we did this study to evaluate all the health effects. We focused on autonomic function assessment. We saw there was a gap in literature, that it was not investigated much, but central nervous system alterations have been reported, and they have hypothesized autonomic function alterations. So we thought we should address the gap in knowledge and then conduct this.
And were there any patients who had really symptomatic autonomic, like collapse, fainting, and the ones who have been chronically working for long periods? Did you come across any? Or
they haven't reported any symptoms, but when we analyzed the data, we could see that orthostatic hypertension was present in about 20% of the fuel handlers as compared to the controls, but the controls also...
There was no one fainting at work? Or...
No, none.
Had there been any previous studies in somewhere else internationally on this type of
Yes, in India as well as in Turkey and Spain, they have assessed fuel handlers and autonomic functions, but they have mainly used heart rate variability as a parameter to measure autonomic functions. Whereas we did both cardiac and cardiovagal parameters and sympathetic parameters using evenings protocols as well as heart rate variability parameters and correlated with US.
So based on your findings, that what's the clinical implication? I mean, I say if you have to give recommendation to the fuel owners, the ship owners, then what would be the recommendation?
At the moment, we haven't found anything negative towards it, but just that autonomic functions are altered in among the fuel handlers. So this was a subsection of a large-scale study where we found respiratory parameters and other things as well, which we are only presenting the autonomic functions today. But here, what we're saying is the central nervous system is altered with exposure to volatile organic compounds. But here, what we found was a more parasympathetic predominance, which is suggested to be more cardioprotective than harmful.
What were your controls?
Controls are age match. People who were not occupationally exposed to any fuel from the RMOH area, we advertised, and then people who volunteered for the study were recruited after exclusion of exclusion criteria, which included exposure to all of the volatile organic compounds.
So are they better of the group because their blood pressures are generally okay, whereas this group kind of economically not well to do and their blood pressures are not checked, their blood pressures are high? Can be like that because your control will be kind of
yes, we haven't looked at the data, but the monthly income were not significantly different. But that would be the only economic parameter that we assess.
What's your comment with regard to sample size?
We would have liked to increase the sample size, but there are restrictions because of limited funding.
So is that enough for us to make conclusions?
Yes, because we have we calculated the sample sizes, and we needed 25 in each group to come to a conclusion. But we tried to increase the sample size so that we could get after technical errors of exclusion of persons, we could still come up with a comparable sample size, so that we opted for 50, which is double the required sample size.
So this is a cheap study, you don't need to spend money.
Autonomic function
to make it 100 or 200.
The thing was that we actually the autonomic function is a part of the study where we did a lot of other biochemical, endocrine, as well as lab function analysis, which required a lot of money.
Right, thank you.
Thank you, madam.